Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Pete, Florida. I'd like to talk a little bit about how schizophrenia is diagnosed. Schizophrenia is a major mental illness, and most people, when we think of schizophrenics, we think of crazy people, or people that act very bizarrely, and they do. But a lot of research basically points to the fact that truly diagnosing somebody with schizophrenia starts usually in adolescence or early adulthood. Usually that's when we see the first onset of symptoms as far as any major hallucinations or delusions. And that's usually when people that I've worked with and the clinical literature suggests that they've really noticed a difference in their behavior. They started noticing that there was something not quite right or actually very wrong with how they thought or how their thought process was. But in diagnosing somebody with schizophrenia, we want to not only look at self-report, but we want to look at medical exams. We want to rule out any type of organic disorder or any kind of other brain disorder or dementia. And we also want to look at substance abuse. Some people coming off of alcohol and have not had it in their system for 24 or 48 hours may also go into what's called a psychotic break or a psychotic split. And that can mimic some of the symptoms of schizophrenia. So when we're diagnosing somebody, we want not only medical history, but we want family history. We want a medical history of the family. We want to look and ask if there's anybody else in the family that has been diagnosed with any kind of schizophrenia or psychotic disorder. And we also want to rule out other types of severe mental illness, which could include major depression or bipolar disorder. So in getting a true diagnosis for schizophrenia, we want to look at kind of a broad range of areas, including family and genetic history, medical history, substance abuse history, and we also want to look at age of onset of symptoms and what type of symptoms or cluster of symptoms are characteristic of the complaints that the person has come to you for. My name is John Bosworth, and we're talking about how schizophrenia is diagnosed.